Oh, okay. How is it? How's feel?
Yeah, Phil is good. This year makes 10 years.
Mm,
And yeah, it's been a great time
mm,
and working and understanding the landscape and positioning ourselves for greater impact.
So essentially, what do you do? I feel.
So Public Health Initiative Liberia is a Liberian-based public health organization
Mm,
that is basically working with the mission to promote and enhance the quality of healthcare delivery in Liberia through leader building. And I feel we have series of programs that we run.
mm,
We have our integrated community-based health program that works with formal and informal community health structures at the community level to improve health service delivery,
okay.
demand generation, and other things. Because many a time people know that the services are there, but they do not know how to access those services and why they should access it. And in fact, why the health facility should be their first choice when they feel sick instead of being their last choice. So we work with community to understand that and change their behavior as it relates to health service delivery. And also we work with community to take ownership and leadership when it comes to the health of their community, their family, and themselves. So in that process, we work on strengthening community health governance,
Okay.
having community to be part of decision making at the health facility. So the government of Liberia has a very well decentralized healthcare system, so to speak, and with governance structure established as well. But oftentimes these governance structures are not really functional. So what we do at Phil also, we help to strengthen these governance structures. We help to facilitate their establishment and help them to be functional. And these structures are the community health committees and that of the health facility development committees.
Why is it important to get the communities involved with the issue of health, community health?
Yeah, it's everything because also then it's because of the community that the health facility exists. It's why the health system exists. And if you have this system and infrastructures established and the people that it's meant for are not using it, then you have a problem right there. So that impacts their overall response to outbreak. For instance, like when we had Ebola outbreak, how community took long before they started taking their people to the health facility instead of going to churches or going to traditional healers and so forth.
Yep.
So,
But I don't know if public health diseases like Ebola, coronavirus have taught us lesson or Lassa fever and all that.
yeah, we are human. There's a need for consistent engagement, and also the service delivery side of it need to keep up that part of the bargain. That is ensuring that when the people get to the facility, the services are available, there are drugs, the health workers' behavior to them is respectful and so forth. So that aspect of it also we work with the health facility and the central government at the Ministry of Health to ensure that the other inputs from their side are there as we create demand from the community to use these services as well and strengthen linkages between them.
Yep. Okay, so let's come to the Global Fund. I mean, I don't know if that was a watershed moment for the launch of the Global Fund. Is that a grant?
Yes, it's a grant, full grant.
To help Liberia fight against HIV, TB, and malaria. How important is that initiative?
Very, very important. It's a critical investment that comes on a 3-year basis to our country. And this one is one of the biggest investment ever. And assistance.
It is the biggest.
Yes, so far so good.
Because I see here 117 million.
Yes.
546,670. Yeah.
Yes. It's one of the biggest so far. And that investment comes in to ensure that children, when they get sick with malaria, they have access to malaria treatment, malaria diagnosis without cost. So it's free of charge. It helps our health system to provide services for the most vulnerable of our society. People that naturally would not have money to access health services are still true. So that funding goes directly to HIV, ensuring that, in fact, it is the only funding in the country that extensively support access to commodities, medicine, and supplies for the HIV response in country, and also that of TB as well.
Okay, so there are 3 areas,
3 diseases, and also the part that comes with what we call resilient system strengthening for health. Meaning you get all these commodities in how do we ensure that it reaches the people and it gets the kind of impact that's needed. So it supports supply chain management, ensuring that from procurement to transport of the medicine and into the hands of the people. It also supports data collection. It also supports some HR costs and so forth, and other running costs as well.
So then who supports all these processes, the distribution? Is it a government in partnership with?
Basically this funding comes for the government to support the government in whatever way they can, particularly as it relates to the 3 diseases. So the funding previously, the government used to receive it, but there have been some challenges with past leadership. And right now, it is in the hands of implementing international organization. But they are almost like just holding the funds and ensuring that the money is there for the Ministry of Health and other partners to do the work.
Okay, so the Ministry of Health essentially runs the
day-to-day activities for everything, ensuring that they have staff in the facility, ensuring that the health structure is there, the health facility is there, and that the inputs get to the health facility and the people receive them. The international partner that oversees that fund, that are overseeing the fund, they that implement the fund, not necessarily overseeing the fund, that implement the fund. They work closely with all of the Ministry of Health structures. That is, for instance, the National Malaria Control Program. They support the National Malaria Control Program to have malaria tests, to have malaria drugs, to have health workers in our facility as well. The same with the HIV. They support it to have staff in our place, have the HIV test kit, and other inputs for the people that are impacted by HIV.
So you as chair of the Liberia coordinating mechanism, what do you do in that aspect?
So the Global Fund does not have an office in Liberia, does not have a physical presence. So everywhere they work, they have the control coordinating mechanism. And for Liberia, we call ours the Liberia coordinating mechanism. And that mechanism provides oversight. It's like a board for the running of the grant in the country. So on a quarterly basis, the implementing partners and that of Ministry of Health come and present how well they are spending the money, what are the challenges, and so forth. And this coordinating mechanism is now with its own monitoring as well. We have an oversight body that also goes out to the field on a quarterly basis, interacting with the beneficiaries of this grant to ask them, how is service delivery? Are you accessing it? When you get there, is it free? How do they treat you? And so forth. And
so you're doing background investigation of the implementation?
Yes, as well.
Okay.
So like that, we sit with the implementing partner and see where challenges are, what are those places that they need to improve, and so forth. So apart from overseeing the grant, providing oversight for a governance for the grant, we also are the body that come together and lead the proposal development process in partnership with the Ministry of Health. We submit the application on behalf of the country. So, for instance, the malaria proposal, the LCM works with the National Malaria Control Program and all of the key partners and stakeholders within the malaria ecosystem, the same with HIV. So all of the interventions are based on the national strategic plans for these 3 disease areas. So I
just wanted to know why these 3 of many diseases.
Of many diseases, we believe that strategic investment in these 3 diseases, they are the 3 diseases also that impact our society very much. Malaria is the number 1 reason why people go to the health facility. Why children on 5 will be to the health facility. Also for pregnant women as well. So they are diseases that impact our population heavily, and there's a need for strategic investment that also serve as a catalyst for further investment in the healthcare system. So though the funding comes to the 3 diseases, but it also supporting other components of the healthcare system, making the healthcare system to be resilient, to have data collection, routine data collection that inform decision maker to have strategic intervention to address the healthcare needs as well. So it is, as much as it is targeted towards the 3 diseases, it also have how you call it,
surveillance system.
It also supports other components of the healthcare system. It supports surveillance, it supports
capacity building,
supply
chain, and all that.
So
say for example, malaria. Is it inclusive of mosquito nets?
Yes. So for instance, this year we're going to be distributing mosquito nets. The pilot was done in Magibi, and now the team is out registering the beneficiaries to have them distributed, to have them receiving those nets. So across the country, almost every household in Liberia should have mosquito nets when that distribution is done. And the malaria control program and that of the lead partner around that will have a time. They will also have media engagement all around that to have the population informed that we are going to be distributing mosquito nets from this time to this time. If you do not receive yours, please reach out to this number. We ourselves as LCM will also be following up on that to ensure that people actually receive those nets, because with the net, it helps to reduce the mosquito population, and in essence reducing malaria as well.
So this going to run for how many years? This
grant runs up to 2027.
Okay.
Yeah.
And it has been launched. What's happening right now?
What's happening right now? Implementation is in full swing. Yeah. Okay. So the implementing partners are working in close collaboration with the Ministry of Health on key interventions that have been earmarked. For instance, on this grant, we have procurement of all HIV and TB test kits and commodities in the health facilities, and also prophylaxis. When you being exposed to HIV, for instance, there are interventions that should be provided to you within 72 hours to ensure that you do not get infected. Your risk of being infected with HIV is reduced, for instance. So we also have support for the healthcare system to help transport commodities, because one of the challenges that have happened, we have medicine and other supplies. Oftentimes to get to the last mile is very challenging. So in this grant for the next 4 years, the grant is also going to support procurement and distribution of supplies to the last mile at these health facilities. So for instance, if the truck is going and it has malaria, TB, other commodities that are needed for that county also are added to get that to the health facilities.
I don't know how the transparency aspect of distribution or that going to work. Are there plans, are there mechanisms put in place to ensure that the process is transparent? So for example, I know for a fact that some of the international partners have complained about how medicines end up in private drugstores, right? We know about the issue in Magibi.
Yeah.
Is there a plan to ensure that if the truck is loaded with medicine from the warehouse to Bon County to one hospital or clinic in Bon County, to ensure that medicine end up in that clinic?
Yes, they are planned. Actually, right now, the distribution of the supply chain right now, the transportation of the commodities from the Central Medical Store in Cartwell to the various counties, right? WFP is supporting that component right now, and also on a quarterly basis before supplies goes out, the information is shared with all partners, and that the essence of sharing that information is for partners to use that information to engage in these counties, in these facilities, and ensure that those commodities that have been listed, that they are taken to that county are actually those commodities that are taken to the county.
You send representative there?
Yes, I mean the information is shared out.
Yeah.
For everyone to have access to that information. And for instance, my institution right now, honor of USAID civil society activity project. We are also monitoring distribution of medicine at facilities across 6 counties. My institution is working in Grand Bassa, for instance. So when that information comes, we send that information to our staff in the field. They get to the county depot and look at the way bill that came to the county, that this, and they also go and check on physical count of those medicine. That I'm sure of in 6 counties for now. However, under the Global Fund, we also have what we call community-led monitoring, having community and civil society involved into monitoring of service delivery, the quality of the services, as well as availability of commodities and so forth. So under that, we also going to have civil society, community-based organization supporting that aspect, monitoring and ensuring that the commodities that leave from the central medicine store travels through the county and to the health facility indeed as exactly as it should. It's a process. We are along our path.
Yeah, I see high level of mechanism put in place to ensure high level of transparency.
Yeah.
Why is that? Why this time? I mean, has anything changed from previous projects launch or the fund and all that?
Yeah, there have been bit of challenges. Program management and other things. You will always encounter challenges, but how best do you find solution to those challenges that help to reduce whatever risks that have been identified? The Global Fund has been in the news over the last 2 years for issue around misappropriation or misapplication of funds, and with that, many times the investment have been done in the country. There has not been a lot of publicity around it, and the population may not know exactly what Global Fund is doing. And for instance, also that these commodities, when they get to the facility, they are actually free of charge. They shouldn't be paying, they're charging them for it. So with all of these things that have been surrounding that, we thought it was that this time around with this investment, we should have a launch, let the Liberian people know that this is the investment that is in country, and they too should be part of monitoring that investment and its impact. So the essence of us launching that fund also is to say the kind of support that is coming to the government and to hold each and every one of us accountable. Say, okay, Global Fund, LCM, you launch this, you say you are investing X million into this health sector. What is it? What is the impact? We want the citizenry to be able to engage in that process and see that if indeed when they get to the hospital, there's treatment for HIV, if indeed when they get to the hospital there's commodities for malaria, for TB, no one should be paying for TB medicine, no one should be paying for HIV medicine, no one should be paying for TB tests. They are all free because why? These are funding that comes from Global Fund, and I think some additional little funding comes from the U.S. government through USAID as well to support intervention along this line. And all of these services should be free as we speak.
Yes,
of now.
I mean, in your write-up on Facebook, you said something very striking. You said the grant was launched by His Excellency Ambassador Joseph Yoma Boaka, Senior President of Liberia, June, which time he once again emphasized his leadership commitment to domestic resource mobilization for health, ensuring co-financing commitments are realized, and zero tolerance for lack of accountability in the sector.
Yeah,
that was a very strong commitment, and you as partners and leaders of overseeing the distribution, the financing, you people look very excited.
Yes, and this is what we wanted so far in the political will and commitment from the government. This speaks to how much the leadership is passionate about ensuring access to health services. The fund is coming in, but the government also is saying that we know that this fund cannot do all. So we as a country also will increase our domestic funding for health to meet the fund wherever it is.
Yeah.
Which is a very great commitment. You don't easily see politicians saying that in the open because the fiscal envelope is tight and everyone want money here and there. But to have His Excellency making that commitment as it relates to the health sector, that was a very great moment for every one of us, more especially for us that come from civil society, because we have been like, our government should be able to fund us, our healthcare system. Bulk of our healthcare system over the years has been heavily relied on donors.
Yep.
And most of what goes into the budget from the government side has been basically for salaries and so forth, and not necessarily to provide
programs.
Yes, for these services. And the president making that great commitment that his government is going to ensure that they're going to increase domestic funding resources to fill in gaps where donors come in, and also co-financing. With this funding, we have a co-financing arrangement that calls for 15% of the investment made to be invested into the health system by the government over 3 years period of the grant. The grant is for 3 years, so the 15% should be spread over 3 years. So 15% of that grant, the government is going to ensure that they invest money into the healthcare system that amounts to 15% of that grant. They do some tangible investment in the healthcare system to strengthen it.
Yeah, it also wins the trust of the partners, right?
Yes, you like during the program I said, when someone is washing your back, you should wash your front. You shouldn't leave everything with them. And the president's statement is a great example of you taking care of your business while others come to support you.
Madam Kiri, what is the overarching goal of this? I mean, you have 3 sectors: malaria, HIV, TB, but TB and HIV are minorities of malaria. I mean, if you look at those who fall prey to malaria, they are almost everybody comes down with malaria.
Yeah.
Tuberculosis and HIV, they are minority groups of that. So what is the goal? What do you hope to achieve? Not you, but I mean the entire project. What it hopes to achieve?
The entire project hope to reduce all of these diseases, reduce their impact, and improve the life of those impacted by it. For instance, HIV. If you are HIV positive, it shouldn't be a death sentence. You should have access to treatment. You should have access to support that make you to live your life, a fulfilling life. The same with TB. It shouldn't be a death sentence. When you have TB, you should be treated and go back to the workforce and do your normal life as it should. So the essence is to reduce death and illnesses as it relates to these 3 diseases, and to also strengthen our healthcare system. Because, for instance, in this funding, we also have 24 million that goes to emergency preparedness. So, for instance, under this funding, we also have a component that invested as it relates to our experiences around COVID-19. So, with this, we also have solarized oxygen plants that have been built across the country in 4 counties. This
What is it?
So when we had COVID-19, people needed oxygen.
Oh, okay.
We never had a capacity to respond. So you without oxygen and you're having respiratory challenges, the chances of you surviving are very slim. So to prepare the country for if there's outbreak or such that we need mass administration of oxygen, we have plants already that have been built across 4 counties.
What are they?
We have Lofa, Nimba, Grand Jide, and Grand Crew. And these plants are meant to support oxygen needs during health emergency. So they have their own place to be able to generate oxygen that can be easily distributed to health facilities across those regions. So this is one great investment that comes into strengthen our overall emergency response.
Okay. And I don't know if there is something in that grant that talks about discrimination, especially for disease like HIV. Is there any aspect that address that discrimination? Obviously,
yes. So you see, for instance, the LCM set the stage for inclusion. Everyone impacted by the 3 diseases are on that decision-making table.
Okay.
Yeah, TB, HIV, malaria.
Okay.
People living with HIV have that association that are part of that, and routinely feedback the LCM on issue of discrimination as well. So we believe that everyone should access health freely, no matter your status, your gender, your sex, your age, your location. You should have access to health care at all times.
What is the prospect, just before we take calls, what are the prospects of all of you partners, the government, through the Ministry of Health, all these partners involved, including Global Fund, the Global Fund itself? What are the prospects for this grant?
The prospect is very high. The impact, of us achieving our goals is very high, because we believe that with strengthening coordination, collaboration, transparency, and accountability, we can have the impact that's needed. We all should be talking together if we are all about the same thing. That's how the platform is.
Okay, you're listening to the Super Morning Show on ELBC Radio. My guest this morning is the chair of the Liberia Coordinating Mechanism for the Global Fund, helping to fight against HIV, tuberculosis, TB, and malaria in Liberia. Very shortly, we'll take calls. But you say here about getting communities involved. Are communities involved in the implementation of this project?
Community are involved, and we want community involvement to be more robust. So therein comes the community-led monitoring, providing tools and platform to communities to be actively engaged in this implementation. Not just as we having community involved, but that community are actually undertaking interventions, activities that feed back into the system and also feedback to them as well. Yeah.
Okay, let's take calls. Call us on 0770581886. I see a lot of documents that you're posting. Is there? Call us on 0770581886 this morning. My guest is Madam Joyce Kilikpo. She's the chair of the Liberia Coordinating Mechanism for the Global Fund. A few days ago, the Global Fund and the government of Liberia launched the grant, 117 million over to fight these diseases. Let's hear you. Good morning.
Yes, good morning.
Good morning. What's the name?
My name is M. I'm calling from Greco County.
Yeah, let's hear you.
Yes, okay. I want to applaud your studio this morning. You have reminded me about the effect of malaria. You see, the 3 things that they are tackling, their government is tackling is good. Malaria, it has a simple name, but when bad or malaria or people are not informed about malaria. So sometimes when it comes chronic to you, when you turn your hair and you start to talk, different things, kids and which kind of say, maybe you feel that people feel you are seen. So I thank God very much for listening to being one of the key of the treatment in Liberia. Thank you very much.
Thank you. Let's hear from this person. Morning.
Good morning, Mr. Babole. How are you?
I'm fine. What's the name? Ishmael?
Yes, thank you, sir. Thank you. God bless you for the opportunity. This is Ishmael Adibin, and I'm calling you from Foya in the home of the district.
Okay, let's hear you.
Thank you so much, Mr. Babole. Actually, I'm very much happy this morning about our studio getting the studio. Most excited for the diseases that they are talking about. But the most important thing that is present on the malaria in our district, the malaria is the most dangerous sickness that giving all heart. The tuberculosis and other things, you are less able of that, but the malaria actually they will try to actually help us to fight it immediately because like in the bushes here, the malaria giving all heart. So I'm very much happy. Let them continue the good job. Thank you so much this morning.
Thank you very much. Morning. Good morning.
Good morning.
Good morning. What's your name?
This is Ezra Baba calling you from the Vagabond Friday this morning.
Yeah, let's hear you.
Let me appreciate this to you guys. Last time on the breaking news, very excited. Doing anything we used to see people move around. But let me discuss the top HIV. One of our brother where Elbc looking program for this. Sometimes they don't operate, but sometimes when I need to in the highway, he decided to program down. Whether the program will take it up and going so that.
Oh, Lawrence, are you there? I think the network is bad on his side, but call us on 0770581886. Good morning. Good morning.
Yeah, hello.
Hello.
This is SMS on Elbc.
Yes, sir. What's your name?
Okay, good morning. Roughly, Mr. Ben Dabe.
Yeah, let's hear you.
I want to say thanks to my former workmate, Miss Kilikpo. Miss Kilikpo, this is Ben Dabe. And I thank you for the discussion this morning. I'm very happy to hear from her and to confirm on my behalf because I say confirm in that many times I try to refer patients from my community to the TB and they say, oh, I don't have money to go there. I say, no, the services there are free. And they will argue with me, nothing is free in Liberia. So in your expose, I want confirming that TB test, TB treatment should be free and is free. So I want to say thank to you for the program this morning and I wish you well, Joyce. I've been calling you on your number, but okay, we'll talk later.
Okay, thank you very much. Good morning. Good morning. Good morning. Sorry. Good morning.
Good morning.
Good morning. What's your name?
I'm Jeffrey Mabia calling from Johnsonville.
Yeah, let's hear you.
Yeah, as Madam, I mean, to the studio is talking, TB is really doing when spreading wide in the country, and we appreciate their involvement to serve as what they are doing. I want to appreciate them so much. Thank you ever so much.
Thank you very much. We can take this call and go back to our guests. Good morning.
Good morning.
Good morning. What's your name?
Good morning. This is Warwa Mission calling from Fellow Community.
Yeah, let's hear you.
Yes, thanks so very much for your program. I want to thank the people there. But one of the things I have on mind is this hepatitis B sickness that is taking all over this country. I don't know what mechanism I did trying to I heard about those rural programs that the malaria, the HIV, and all of them. What are they doing concerning about this hepatitis B? Please, thanks so very much for taking.
Sure, that's a good concern. I will take this one. Morning. Morning.
Well, good morning, family. This is Johnson Kilikpo, and I'm joining from River G, Town.
Yeah, let's hear you from River G.
Okay, thank you also much, and let me say thank you to your studio there this morning. So you have said it all. But then what really come to my memory is that in River G, and the only referral hospital that we are dependent on is a fee for service. So I don't know what mechanism this rule are putting in place for those kind of terrible disease that you just listed this morning that will be free of charge. So I don't really know how it will happen because there's a fee for service here. So I want us to also use our radio to inform people too. You allow people being in the know of what is going on in the nation's capital. That's my recommendation too.
All right. Thank you. Morning. Good morning.
Yeah, good morning, brother.
Yes.
I'm Gabriel Saki calling from.
Yeah, go ahead quickly.
I want to tell the madam thank you very much and thank the Liberian government very much. Thank you for the exercise they are taking towards these diseases. But my question is, will they involve the chief states, which is the community health assistance, to help into, funding this program for ourselves because we are the front runners. Thank you very much.
Okay. We'll hold you there and go back to our guests. Yeah, a couple of concerns. Of course, there are also compelling health diseases like hepatitis B. Are there programs coming up for them? Also, some of the programs that will be coming up under the fund.
Okay, thank you. For hepatitis B, the government has realized hepatitis B is a issue that's starting to be a challenge for the health sector. What government has done, one thing, I do not speak as government, but I speak as a partner to government and the fact that we work with them in the health space. So I know for sure that government has put in mechanism that the next generation of Liberians, for instance, over the last 10 years, will not have the rates of having hepatitis B will reduced. So you have vaccine. That's why it's important for us to ensure that all of our children are fully vaccinated. The government has hepatitis B vaccine currently for children that is free of charge, and it's given to them to prevent hepatitis B. For adults, I know in the National Health Policy Plan and Strategy, there's plan there to address hepatitis B for the whole population. So, but as it stands, the best I can say to everyone is to prevent as much as possible, learn to practice safe sex, and also ensure that you attend hospital that ensure infection prevention and control, that they're not using one injection for 2 person, or you ensure that So the best we can do as local organization, as civil society, is to create awareness on prevention of hepatitis B and continue advocacy with the government to ensure that people have access to vaccine to prevent hepatitis B, and that those also that come down that are already infected can have access to some supportive treatment that improve their life as they live on. So that's basically what I can say.
Another concern is the hospitals, the kind of hospitals that get the supplies, because somebody called from Grand Crew that they refer hospital. Are these kinds of hospitals captured?
Every hospital, public hospital in this country, government hospital, receive this medication, these supplies from the 3 diseases, and all of those facilities should give those medicine free of charge and services surrounding that. What we have always said, and we continue to say, we're still in engagement with the government on that. Facilities that have fee for services, for instance, they should clearly put a notice that for HIV is free, for malaria is free, for TB is free. Because all of the inputs that are coming to have those services there are provided through this fund, and people should not pay for it.
Yeah, because that's the transparency chain.
Yeah.
So you recommending that administrations of health facilities,
yes,
print a big banner, free treatment for HIV, malaria, and TB.
Yeah.
Okay, because they're already paid for.
Yes, they already paid for. Okay. We had a situation in Magibi that we sorted out. Yeah, a patient was being charged around 18,000 to pay for TB medicine. Yes, and once we let the community know this was it, and they provided us that information, we followed it up and ensured that the patient was refunded and so forth for whatever money that has been taken from them. So the situation in River G, I'm going to pick it up as well, and the oversight committee is going to make a visit there to see what's unfolding and engage with the county health team on addressing those challenges. That's why we have decided to do a lot of publicity around this fund to ensure that the citizen gets the information and demand it from the service provider.
Yeah, and I knew I wanted to ask a question about our social contract. In a case where you investigated and found out that this health facility is actually charging people for these treatments under the grant, what do you do? Do you disconnect them from the fund? Do you remove them? What are the
greater good is for everyone to have the access to the medicine and the services that are provided as it relates to the diseases. So we treat it by case scenario. Get to actually know, like, if people say somebody is charging you, how much are they charging you, who's doing the charging? Because when you get to the facility, they say no, we don't charge for that. So you need to get the actual evidence that you went for treatment, and they charge you for malaria test, they charge you for HIV, they charge you for TB. Once you provide that information to us, we are going to pick it up and ensure that whatever money they charge you is refunded, and that whosoever is doing that will also be reprimanded by the system as well.
Okay, Madam Kilikpo, we are already out of time. You want to give your parting comments before we leave you?
Thank you to LBS for having us on this great show. Thank you, Vafle. And I just want to say to the Liberian people, together we can improve our healthcare system, and that the information provided around services as it relates to malaria, TB, and HIV, they should be able to use it. If for any instance they are having challenge with having access to those services free of charge, our offices are available. My institution is Public Health Initiative Liberia. However, we also have the Secretariat for the Global Fund that is located at JFK, at JFK compound, right at the blood donation units. Let's say, no, not necessarily blood donation units, but at the dialysis center, in the same building as the dialysis center. We have the Secretariat of the Global Fund there. They can also go and inform them. But over time, we engaging with the implementing partners to provide a medium where people can report these cases. So let the population look out for those information. We'll use the same media to also pass on that information on maybe a short call that people can call and report cases where they are being charged for it. But also want to say thanks to this current leadership for the political will and commitment to improving health service delivery through increased investment in the healthcare sector. We look forward to the next budget period to having budget lines as it relates to these three diseases and other key health issues that government has made commitment to increase investment for. Because outside of them having budget line for these things, we cannot clearly state how much government is investing as it relates to their own contribution around addressing those issues. So thank you. God bless us all, and let everyone look out for the next distribution. People will be coming to take your information, allow them to take it. And this is the first time the net distribution is going to be digital. We're going to have a digital net distribution whereby your information, once it's in there, then it is uploaded.
Once you benefit.
It's uploaded immediately with your code and other stuff. So thank you very much. She's Madam Joyce Kilikpo. She's the chair of the Liberia Coordinating Mechanism for the Global Fund to fight against HIV, tuberculosis, TB, and malaria in Liberia. The Global Fund has given a grant to Liberia in the tune of over 117 million to ensure that services for these diseases, TB, malaria, and HIV, are free of charge at all public health public institutions, facilities across the country. She's been my guest. Next up, I'll be speaking with Councillor Finlay Kanga. He's the head of the Office of the Ombudsman.